Well, welcome everyone. And we are very excited to be here today with the CHAMP staff. And we at Families as Allies are very excited to be partners with CHAMP. We wanted to feature y'all, especially this month, because May is Mental Health Month, and the Federation of Families designated flipping the script as a theme for children's mental health. And we've been talking a lot about that this month. And one way we want to flip the script is to stop putting so much emphasis on things that are wrong and things that are bad, but new approaches and that are getting the services out to where our children are. And we think CHAMP is doing an excellent job of flipping the script. So I wanted to start off just by letting y'all introduce yourselves real quickly. And if one of y'all could also tell us a little bit about what CHAMP does.
Yeah, I'll go first. So hi, my name is Gigi Holder. I am the program director for the CHAMP program, which is Child Access to Mental Health and Psychiatry. So first, just saying a little bit about CHAMP. It's a consultation line, a phone call line for medical providers, so pediatricians, nurse practitioners, family medicine physicians, to give a call and speak to a mental health specialist regarding the care of their patients. It could be with a diagnostic question. They want to know more about a medication. If they have questions regarding medication concerns for their patient, they're able to call us and speak to either a child psychologist, child psychiatrist, or social worker in real time. And that could be whether the patient is in clinic with them or if they want to consult at a later time, maybe when they're free to do so. And so my role as the program director, I also serve as the mental health coordinator. So I get a chance to take those calls from the providers when they call in. If it's something I'm able to tend to at that time, I'm able to, or I pass it along to one of our child psychologists or our child psychiatrist, part of the program.
Dr. Meredith?
Yes. Hi, I'm Dr. Philip Meredith, and I want to thank Gigi for giving us that introduction to what the CHAMP team is all about. And to you, Joy, for allowing the CHAMP team to have a few minutes to for us to tell you about our program and your listeners. So it's something that we're very excited about. We've been in existence since 2018. And as a child psychiatrist and member of the faculty at UMC in the Division of Child Psychiatry, I serve as the medical director for the CHAMP team. And I think Carson Allen's next to introduce himself.
Hey, my name's Carson Allen. I am the resource coordinator for the grant. So I assist Gigi with all of our resource and referral when a provider's looking for a good fit for a patient with a mental health concern. We also track some data on our program to show the effects of the consultations. You know, are we increasing certain medications, decreasing, and stuff like that. And so it's interesting data to work with. And that's what I do on the team. Thank you.
All right. Hi, I'm Dr. Dustin Sarver. I'm a child psychologist here at UMC in both Department of Pediatrics and Department of Psychiatry. I have the wonderful privilege of serving alongside Dr. Meredith as the clinical director here for the CHAMP team. And it's my job and duty to help lead the team in the grant, but also to do consultations, talking with primary care providers as part of doing all the consultation and really service linkage supports that we're able to do with it. So thank you very much for the invitation to be able to talk with you guys today and to really talk about how we're flipping the script here in Mississippi with CHAMP. I love that idea that we're able to do that and to be a part of that goal.
And I'm Terrence Hibbert. I am the project manager on the CHAMP team. So my job is to kind of clear all the administrative stuff out of the way so that these four wonder people can do their wondrous work.
Well, all of you guys working together do wondrous work. And I can attest to that because we work with y'all on a regular basis. And I'm grateful on behalf of Families as Allies. And y'all know this, but I want everybody listening to this to know too. I am so grateful as a mom for what you're doing, because I hope that really sank in with everybody who is listening, that any medical provider who works with children in Mississippi can call y'all and get help if there's a child in their office or a child who they see, who they're thinking about, and can get help from you about how they can better serve that child. You're not in this to try to get those patients. You're doing everything you can to keep those children in that primary care setting so that they can get the help they need, and sharing your expertise. And I just think, as a mom, when my child was young, there was no way I was going to get to one more appointment. It was just too much. And you guys are making that so much easier. And then for adolescents who often don't want to go somewhere else, there you guys are. It's just great. And I don't know, do y'all want to have any other comments about how you see CHAMP as flipping the script? And also, can you give us that number in case there's anybody out there, a medical provider who's listening, who would like to be part of this program?
Sure, I'll just jump in here. So I'll start with the number. A medical provider, office manager, anybody in the state of Mississippi can call the CHAMP line at 601-984-2080. So 601-984-2080. They could also put in a request if they're more electronically inclined at www.umc.edu/CHAMP. The way I like to think of how CHAMP is flipping the script is that, in Mississippi, it's really been a struggle to have strong connections and access for kids to have mental health needs. There's a lot of times it's, getting just as you said, Joy, another referral, another appointment, and to be able to see the specialist. And one of the ways I feel like we really are flipping that script is that we're almost like the psychologist or psychologist down the hall that every physician in the entire state could have access to, just if they wanted to, quote, pick up their phone to call their colleague down the hall. We are those colleagues, and we are enabling a service to do that, so that they can do that free of charge. Just be able to talk to a colleague, and ideally, hopefully, a friend about the patients and the family's needs, and how we can best support so that families can know that their children are getting cared for the best way possible.
Well, and I think you all are making a lot of friends, because one of the privileges of working with you guys is getting to see the pediatricians. That's who I've mostly seen be so excited about this program. And nurse practitioners, I haven't gotten to deal with them as much. It's just really exciting to see that they feel like they can do a lot more for the children they serve because of you guys. I also wanted to ask a question about stigma. One reason we've been talking about flipping the script is we feel like sometimes when there's a lot of emphasis on stigma, that can actually put a bigger burden on families. Like they have to get over their stigma to go find help. And that's not at all, I don't think, how that concept was ever intended, but kind of what it's become. And so we've been talking about when the system is really set up the right way, and the services and supports are out there where the children already are, that it starts decreasing stigma because our system becomes less stigmatizing. And I was just wondering, have any of y'all ever thought about that in relationship to CHAMP, how you may be changing that bigger picture of the whole idea of a child needing some help with a problem related to mental health being stigmatizing?
Well, that was one of our goals, Joy, in forming the CHAMP team in 2018 and applying for the federal grant that Dr. Sarver wrote mostly on his own in less than 2 weeks that enabled us to start the CHAMP team. And we envisioned a model of care that would flip the script, although we weren't using that phrase at the time. It's certainly appropriate because when I think of the term flipping the script, I think of thinking outside the box, doing something a different way that's not been done before, challenging people to rise to the occasion to utilize a new method of health care delivery. And that's what we feel like we're doing. That's what we feel like we're flipping the script, is we are offering something that's never been offered before in Mississippi, to have a phone number that's used from 9 to 5, Monday through Friday, totally for free for any primary care provider, whether you're a pediatrician, family medicine doctor, nurse practitioner, to be able to call and speak within a few minutes' time with a child psychiatrist or a child psychologist or a social worker or someone who's an expert on resources and referral. That's never been done before in Mississippi. So we feel excited about our ability to flip the script in that regard, and we look forward to expanding the program even further and beyond the lifetime of the grant, which will end in 2023. We're already working on our sustainability to keep this program up and running. And in terms of stigma, we do think that resources like CHAMP help reduce stigma because it helps educate providers as well as family members and patients, and it helps provide services locally right there in the primary care provider's office. The patient and their family don't have to travel long distances. They don't have long wait times. So we're getting appropriate care provided through the primary care provider in consultation with us in real time that benefits everyone. And we think that's an exciting part of our ability to flip the script.
I would agree. I am so grateful to you guys. You're doing great work. And was there anything any of y'all wanted to share that you didn't get a chance to say?
One thing I would like to add is that, like we were talking about our sustainability efforts and all of that, so we're really trying to make more of a push and really have from the beginning of letting providers know that, yes, this is a free resource in the state. You can call, at the times that we're available, and that this truly, again, is a resource for you, for the providers to give us a call. We try to remove the veil, if you will, and put a face behind the name of CHAMP to let them know when you call, obviously you're speaking to a real person, but who that person is. And so we offer times to meet with clinics. Of course, everything is virtual right now, but really try to take that personal step and let individuals know who they're going to be speaking to, because I think another part of that when providers give a call is that they know who they're talking to. They'll know who, I've talked to Dr. Sarver before. He helped me with this case. When I call CHAMP again, I can speak with him. Or Dr. Meredith, I consulted with him, on a case regarding medication. So there is that relationship piece right there that is an important component to this program as well. So we definitely do value that, and we put that out there too, that we want providers to be comfortable with calling us and knowing who they're going to call when they pick up that phone.
Definitely the personal touch.
I have one thing I'd love to say or that comes to mind in terms of flipping the script, especially on stigma. So many times a barrier for families and kids, especially adolescents, as you mentioned, like to getting mental health care is this idea of like, I've got to go see the psychiatrist. I've got to go see the psychologist. And it's like this mystical, scary, maybe even like something that has a bad association or connotation to it. Whereas what we're doing is we're enabling, talking to primary care providers, and it's almost like psychiatry and psychology and mental health are going to the medical home where there really stigmas really don't exist. If they do, it's certainly not in as large of a fashion. So we're able to kind of come get this, mental health expertise there in the medical home with trusted providers who are doctors and nurse practitioners and other physicians who are just, you go to them for all of your healthcare needs, body and mind. And so part of reducing stigma is to realize that, I can go to my primary care doctor and talk about these things, or my doctor is asking about these things. We try to enhance and, as Gigi said, educate providers on all the elements of mental health care so they can deliver pieces of that in the medical home. And I think when that does, it does bust down the barriers of stigmatization, knowing that mental health care is physical health care. It's all the part of the mind and body. And I don't know, for me, I love knowing that we do have a major impact on kind of breaking down a barrier of stigma for mental health here in Mississippi.
It's huge. It's huge. And that's why this whole flipping the script, we're glad that you're leading this series. You're the first one we're doing, because you guys are really out there flipping it. And I don't even know if you realize how much you are, but it's just terrific what you're doing. So any other thoughts? Okay. Well, I will just say thank you for all you do. And thank you for helping to flip the script for our children in Mississippi. Thank you so much.
Thank you for having us.
Thank you.
Absolutely.
Thank you, Dr. Hogue.
Thanks, Joy.